Pain is interesting in that we don't know as much as we think we know, so there's a constant innovation that's occurring. It makes the field very interesting as a care provider because it means that I'm always learning the cutting edge, and that's, I think, the benefit of being at a place like Weill Cornell Medicine. Our department focuses on innovative and novel ways of treating both acute and chronic pain conditions that limit the need for long-term medicinal management and/or impact of medicines. Just like other medical conditions like hypertension, diabetes, and so forth, you don't want to be stuck on medicines for life. And if we can offer you alternatives to that, generally patients will do better in the long term. In terms of what services we provide, I would say from the most conservative, which would be things like mild medicinal management. But the most common things we do are joint injections, which are usually done under some kind of imaging modality, whether it's fluoroscopy and/or ultrasound. Alternatively, we also do a lot of epidural steroid injections as well as nerve ablations, which are stereotypically for back pain. And the last category of implantable devices, intrathecal pumps and spinal cord stimulators. But those incisions tend to be very, very small with small recovery times, and people do very well. We've established a transitional pain program in our department that allows for more seamless transition of care from the outpatient into the inpatient and then back to the outpatient realm to remove some of the hiccups and care gaps that patients face. So in an effort to try to fill that clinical care gap, we've created a system in which we can see these patients in advance in order to create and tailor a plan unique to that patient and then optimize them in the inpatient setting in order to reduce the amount of grief they might have associated with pain during the recovery process. I think it alleviates a lot of the anxiety associated with that process, but also gives security to the patient as well as the provider that the patient will have less of a challenging time in that window of time where people are most worried about how they're going to feel and how much pain they're going to have. It's always a very unique experience when you've been able to help somebody who's been suffering for a long time and have them return to some of their routine and their daily quality of life. Because of the nature of pain impacting all their surrounding support system and loved ones, when you can treat someone's pain, you improve not just their quality of life, but everyone's around them as well.